Nurse satisfaction and retention is a challenge for all hospitals, especially in overcrowded emergency departments. At the Presbyterian Intercommunity Hospital Emergency Department in Whittier, California, a new bed placement system was integrated into the Vocera System, expediting patient flow, improving patient care, and streamlining internal communication.
Nursing is always about a balance between spending time with the patients and taking care of all the other things they have to deal with.
We had a problem with being able to communicate between the emergency department and our access department.
I literally couldn't keep nurses in that access position because of the stress.
So we started to look at what were some of our barriers for patient flow. And we realized that the communication between the emergency department and access coordinators really needed to improve.
Hospitals are starting to move away from the old traditional paging system. We're starting to see more devices such as a Vocera badge, which allows for more direct, immediate interaction and communication. Hey Ramona, I just noticed that one of our patients has a low potassium.
Moving patients through the system, that's what it's all about. In the emergency department, we're just starting their care, and we need to move them to where their care can continue so that we can continue to start care to other patients that may be sitting out in the lobby. Call ED charge nurse.
ED charge nurse. It decreases the amount of time we have to walk around the department and look for people. Call ED charge nurse.
We implemented a bed placement system, and we integrated the text messaging feature of Vocera into that. Our emergency department and our case management department work closely with regard to bed placement.
If I'm not at the desk and I'm not sitting in front of the computer, I'm getting an audio cue that I have a ready bed, and I can look on the badge, see what bed is assigned, and then let the nurse know without having to sit down at the computer, look up the information.
And by implementing the text messaging along with our electronic solution for bed request, we've been able to maximize communication, decrease anxiety between departments, and improve the flow of the patients.
The patient flow at the front of being able to have that communication between the emergency room nurses, who are very, very busy, and our access coordinator nurse, who is very much busy in moving patients throughout the house, they are both also able to reach each other whenever there are any questions. And so that flow from the front all the way through and out to the next level of care has been affected in a much positive manner because of Vocera.
Yeah, you know, one of the nice things about using Vocera is, number one, you don't have to know everybody's name anymore, and you don't have to know their telephone extension. I can use Vocera to call my ED case manager, and I don't need to know which case manager is on duty right now. I just need to know that I need my ED case manager, or I need my ED social worker, and I can call using Vocera by simply stating that.
We now have people who are happy in that job. And not only that, our ED charge nurses work and collaborate with the access folks instead of being at odd ends with them. So when we look at our statistics now, we know that our success has been in our communication, because from the 2-hour point of view of request to assignment, we're at about 16 to 18 minutes. And from assignment to placement, from 3 hours plus, we average about an hour and a half or less. And that's real good concrete measurement of success for us.
Through the use of technology to decrease the time frame that it takes for us to move patients, patients are getting the care at the right time and the right place in this facility.
Staff satisfaction is your leading foundation for patient satisfaction.